video, let us cover the morphology of atherosclerosis. Okay, first of all, in the early life, you can see fatty streaks and dots. This is how it all starts. Then you will have gelatinous lesions. Then you will have Atheromatous plaque. Just note what exactly they ask you in the exam. If they ask you morphology of Atheromatous plaque, you will have to write only this point, and after that you have complicated plaque. Okay, so basically fatty streaks and dots, this is there in very young people. First year of life itself it will be there in major arteries and aorta. Basically the posterior wall of these arteries, you can see these fatty streaks and dots. Basically grossly you can see yellow dots. Okay, microscopically you will see that these are lipid containing smooth muscle cells, foam cells, etc. Okay, now we are moving on to the gelatinous lesions. Here gelatinous lesions develop in the intima of the aorta. Intima of aorta again, and major arteries, same thing. Okay, and they develop again in the first few months of life, similar to the fatty streaks, same thing. Okay, like fatty streaks, they can become precursor of plaques. They can become the precursor of plaques. Few months of life, they can become precursor of plaque. Okay, they are round oval circumscribed gray elevations about 1 centimeter in diameter. These are a little big, 1 centimeter in diameter. Those were only 1 millimeter in diameter, if you remember. Microscopically, you will see that they are the foci of increased ground substance in the intima with thinned overlying endothelium. Nothing much here. You can leave this. Moving on to Atheromatous plaque, which is important for you. For this, you will have to look at diagrams and you have to draw them also. A fully developed atherosclerotic lesion is called Atheromatous plaque. Also, it is called as fibrous plaque. It is also called as fibrous plaque. Okay, it is also called as fibrous plaque. This is completely developed atherosclerotic lesion. Okay, unlike fatty streaks, these are selective in different geographical locations and races. These are particular, not in everybody, like gelatinous or fibrofatty plaque. This is present in specific places, in specific races, and in advanced age, right? We have already seen all this. So it depends on age, race, geographic location also. Okay, so this is not in everybody, right? And mainly it will affect the abdominal aorta. Mainly it will affect abdominal aorta. Okay, you can see in descending aorta also, descending thoracic aorta also you can see. Okay, and in the aortic arch also you can see. Fine. Now grossly we are trying to explain the morphology here, gross and microscopic. Let us look at gross. They are white to yellowish white lesions, white to yellowish white lesions. Okay, they are varying in diameter from 1 to 2 centimeter. They have a raised surface. Okay, and they have few millimeter to centimeter in thickness, few millimeter to centimeter in thickness. Fine. The cut section of plaque reveals the luminal surface as a firm white fibrous cap and a central core composed of yellow to yellow white soft porridge like material, hence named atheroma. So we have already explained this to you. In the center it will be soft lipid, right? That is why it is called as atheroma. This is atheroma and this is the sclerosis. The outside part is the sclerosis. If you remember the first video, we have already explained this. This will be yellow, right? Why will it be yellow? Because it is soft lipid like material, right? So a cut section of the plaque reveals the luminal surface as a firm white fibrous cap. So luminous white fibrous cap and a central core composed of yellow to yellow white soft porridge like material, atheroma. Okay, that's why it is called as atheroma. This is athero and this white one will become the sclerosis. Microscopically, the appearance of the plaque depends depending upon the age of the lesion. So microscopically it will depend on the age of the plaque. Okay, here we have given you a diagram, fully developed Atheromatous plaque, how it will look. What and all features can you expect here? You will see a luminal part of the fibrous cap. So basically you should be seeing a fibrous cap, right? First of all, you will be expecting what? A fibrous cap. It's shown here. Can you see? Fibrous cap. Then you have a cellular area. Then you have the deeper central soft core. Let us look at the details of what we will find in the fibrous cap. It is actually the luminal side, right? It is the luminal part, right? It is the luminal part. It is superficial, right? It is this fibrous cap is covered by the endothelium, It is composed of smooth muscles. There can be smooth muscles here, right? Dense connective tissue, extracellular matrix containing proteoglycans and collagen. Okay, did you understand this much? So this is what is the fibrous cap. In advanced stages, the fibrous cap, the collagen will be very dense. Okay. So did you understand the fibrous cap? It is covered by endothelium. It is the luminal part of it. It is the superficial part. There can be smooth muscles, dense connective tissue, extracellular matrix. You can mention fibrin, proteoglycan, collagen. Fibrous cap will be very dense if it is an advanced atheroma. Okay. Did you understand this much? Can we move on to the cellular area now? Cellular area, under the fibrous cap it will be there. It is comprised of a mixture of macrophages, foam cells, lymphocytes and few smooth muscle cells which may contain lipid. So let's add that information here. Cellular area is below the fibrous cap. It has macrophages, foam cells, lymphocytes, few smooth muscle cells which may contain lipid. Okay, this is what is the feature of cellular area. Look at this diagram. Can you see the cellular area here? Can you see the cellular area here below the fibrous cap? This cellular area, this one actually to be more precise, this cellular area has macrophages, foam cells, lymphocytes, smooth muscle cells which contain lipid. Okay. In the advanced atheroma, the smooth muscles will become atrophic, that is, they will become poorly nourished. Okay. Can we move on to the deeper central soft core? Can you see here? This is the central soft core. Now we are going to explain this one, the core. Central soft core we are going to explain now. It consists of extracellular lipid material, extracellular lipid material, extracellular, the lipid is not inside something, it's extracellular lipid material, cholesterol cleft, fibrin, necrotic debris, lipid-laden foam cells. See, lipid-laden foam cells are here. I think fibrin should not be here. Fibrin is in the core. Okay. In the core they have put fibrin. Cholesterol cleft, extracellular lipid material, fibrin, necrotic debris, all that you should be able to see here. What and all can you see here? Necrotic debris, foam cells, fibrin, cholesterol clefts. Can you see the cholesterol cleft here, this white space? Foam cells, can you see? These are the macrophages which have swallowed the lipid. Then you can see lipid pool, extracellular lipid pool, necrosis, and media is thinned. Thin media you should see. Media is thinner than, you can see the media is thin here. Please practice this diagram nicely. It will fetch a lot of marks. Okay. So this is the Atheromatous plaque. Till now we finished what? Fatty streaks and dots, gelatinous lesions, leons, some people can say, gelatinous leons, Atheromatous plaque, in which we saw fibrous cap, cellular area and deep central soft core. Just note that the gross also is important. You have to explain the gross also. Then microscopic structure we will explain. In the next video we will come and cover this one, complicated plaque. See you in the next video. Bye bye.